I think what's happening is that because there are more and more people dealing with Alzheimer's, it's truly becoming a global epidemic. There's a real need for point people that family caregivers can turn to. Care managers and dementia coaches, patient advocates each play a slightly different role, but each one of them can help a caregiver navigate this whole health system, or what purports to be a health system. Patient advocate, for example, can really help with the navigation in a hospital, or help with things like long-distance physician visits, and really be there for the person with Alzheimer's to make sure that he or she gets the services at that time, to ask the questions if a family caregiver can't be there, for example. The person with Alzheimer's may not know to ask the question, may not be able to ask the question. A patient advocate can accompany a person to a physician appointment, for example, and speak up. But their role is a little more limited in really navigating doctor visits or getting the person through a hospital visit or something along that line. And that's where most people who may be familiar with the term patient advocate have experienced them, is perhaps in a hospital. And it goes beyond that mom doesn't like the food. It's, is she getting the rehab she needs? Are the meds being reconciled? Is she being treated appropriately for her condition? And very often in a hospital setting, for example, people may not be aware that the person has Alzheimer's because it may be early onset. They may just appear a little confused. So it's very important to get somebody in there that can speak up on the patient's behalf and say, you need to talk to me, and you need to explain this, and you need to reassure this person because they do have this disease, and you can't treat them the same way you treat a 35-year-old who doesn't have it. A care manager is a more comprehensive role and does just what it sounds like. He or she is responsible for the broader-based care and for helping the family navigate the entire process. And it could be anything from finding a nurse practitioner in the community, if that's what the person desires, to making recommendations for respite care or assisted living facilities or anything along that line. And also putting the person in touch with social supports or community groups that might be able to help out with care. Care managers are often nurses or social workers who have taken on this broader role. It almost falls to them naturally that instead of just managing one aspect of the person's care, they tend to take on the broader component. And from the people I spoke with, that can really be a lifesaver when it comes to managing care long distance. Because you need somebody that can be on top of it when you can't be there, or if you're working or you're juggling other responsibilities. So by having a care manager who knows what's happening on the ground, it really can bring the caregiver a lot of peace of mind. People I know that have hired care managers will tell you absolutely they're worth the money. You can't put a price on peace of mind. And when you're confused about the health system, when you're dealing with something that's 1,000 miles away or more, and you can't be getting on a plane every week to go visit mom in Florida or Arizona or wherever he or she happens to be, then yes, they're absolutely worth the money. The key is getting a qualified care manager, getting one that's not willing to take no for an answer and who will really step up and be a hands-on helper to give your loved one the best care that's possible. Networking, I think, is a very important aspect of caregiving. First of all, I think it's important for caregivers to know that they're not in this alone. And very often the best referrals and the best pieces of advice come from other caregivers who have been in your shoes, who have experienced similar things, who may have found a wonderful care manager or a wonderful respite facility that you won't know about because you haven't been there yet. So talking to other people, other caregivers, other professionals, people in your community. You can go through a church group, or you can go through another religious organization. You can go through, sometimes even a library might have guest speakers, or your local hospital might have a community outreach program. But I think it's important to tap into the knowledge base of as many people as possible and get advice which you can then weigh the pros and cons of and figure out what's right for you. Obviously, not everybody's situation is identical, but many people have had to deal with similar frustrations and challenges, and it saves you from having to go through some of that frustration and reinvent the wheel with every step you take. And by the same token, I think it's important to give back to others that are going through what you're going through. And even if it's something as simple as a recipe, share it, because you're building your own community. You need that mutual support. I think the best way to manage geriatric care is one day at a time. It's very, very difficult to plan long term, although in some instances you have to, for example, with a living will or healthcare proxy. But I think it's best to realize that this is not a disease that is the same day in and day out. You're going to have good days and bad days. You're going to have questions, you're going to have concerns, and you're going to have issues next week that you didn't have this week. You can't worry about what's going to happen next week because you have to deal with today's reality. And I think if people can take it one day at a time as best as possible and really keep the lines of communication open, not be afraid to ask questions, keep a log of what's going on, keep their sense of humor. That I've heard a lot, is that it's important to have a sense of humor, as dire as things may be sometimes, and to appreciate the person you're caring for who they are today, and not dwell so much on the past or the future and what might happen, because nobody knows. But manage the care for today and worry about tomorrow when it gets here. One of the people I spoke with is a dementia coach. Her name's Carrie Mills. And she's in a really new kind of healthcare world, because this kind of position never really existed before. But she's found it incredibly helpful for families to have somebody like her come in, and her background is healthcare management, and help them understand what the new relationship has to be like. For example, one of the things she said to me was that the person with Alzheimer's really can't change who they are or what's happening to them. So it's up to the caregiver and the family members to make the changes in how they communicate with the person. One of the examples she gave me was, for example, if mom thinks it's Thursday, but it's really Monday, does it really matter? Rather than trying to step in and correct in this urge to be right or to help mom maintain some more independence, does the fact that it's Thursday or Monday really matter to mom? What she needs to know is that it's another day and she's still around. So work with what you have. And if you can ask her simple questions, or you can get into a conversation and mom wants to think it's Thursday and it's Monday, so what?